may be wondering what stroke is.
Isn't a stroke like a heart attack?
Actually, it's a brain attack. It occurs when blood supply to the brain is interrupted or reduced, depriving the brain of oxygen and nutrients, causing the brain cells to die.
Oh, so that's what a stroke is.
There are two types of strokes. Ischemic stroke, which is when the arteries to the brain become narrowed or blocked, reducing blood flow. This type accounts for 87% of all strokes. Then there's hemorrhagic stroke, which is when a blood vessel in the brain leaks or ruptures. It is a less common type, which only accounts for 15% of all strokes, but is responsible for 40% of all stroke deaths.
40%?
Some symptoms include sudden numbness or weakness of face, arm, or leg on one side of the body. Confusion, trouble speaking or understanding. Sudden trouble seeing in one or both eyes, or seeing double. Sudden trouble walking, loss of balance or coordination. And a sudden severe headache with no known cause. If you notice any signs or symptoms of a stroke, think fast and do the following. Face. Ask the person to smile. Does one side of the face droop? Arms. Ask the person to raise both arms. Is one unable to raise up? Speech. Ask the person to repeat a simple phrase. Is his or her speech slurred or strange? The most important one is time. If you observe any of these signs, call 911 immediately.
911, got someone having a stroke?
Risk behaviors associated with stroke. Being overweight or obese. Being physically inactive. Heavy alcohol consumption. Using illicit drugs such as cocaine and methamphetamines. A high blood pressure. Cigarette smoking or secondhand smoke. High cholesterol. Diabetes. Obstructive sleep apnea, where the oxygen levels sporadically drops during the night. Heart failure, heart defects, heart infection, and abnormal heart rhythm. Having a history of stroke, heart attack, or transient ischemic attack, or TIA, and being 55 years or older. There are ways to prevent having a stroke. Maintaining a healthy diet and eating foods low in saturated fats, trans fat, and cholesterol can help prevent high cholesterol. Limiting salt in a diet also lowers the blood pressure. Doing physical activities can help maintain a healthy weight and lower cholesterol and blood pressure. Quitting smoking decreases the risk of stroke. And limiting the amount of alcohol consumed can help lower blood pressure. Treatment plans available for stroke. For ischemic stroke, emergency treatment includes aspirin and alteplase or TPA. For hemorrhagic strokes, emergency measures focus on controlling the bleeding and reducing pressure in the brain. Surgery is usually involved. Stroke recovery and rehabilitation. This focuses on helping the patient regain strength and recover as much function as possible to return to independent living. This includes physical therapy and speech therapy. Meet the director. Stroke has personally affected my family because my grandpa died of stroke in 1983, and so have others in our family before and after him. This history of stroke increases my chances of having one, so knowing more about this condition and knowing the ways to prevent it decrease the chances, because stroke can happen to anyone at any time, no matter the age. This PSA is brought to you by the Little Ray of Sunshine Productions. Special thanks to the receptionists at Best Western.